This week I've chosen to review the World Health Organization's discussion paper number 9, entitled Equity During an Economic Crisis, Financing of the Argentine Health System. Argentina has the unique distinction of having had a dramatic collapse of its economy in 2001, which by some estimates eliminated up to 40% of its national wealth overnight. The Argentine peso was devalued, many domestic companies went out of business, foreign companies abandoned the country, and even today the country is not yet fully recovered. The article compares the Argentine healthcare system in 1997, before the economic crisis, to that in 2002, after the crisis was well underway. Over this period of time, the amount of money allocated to healthcare remained fairly constant at between 8 and 9% of the Argentine GDP, but because of the decline in the GDP, the amount of money spent per capita dropped from US $669 to US $242. This is a decline of nearly 64%. The Argentine health financing system consists of a publicly funded sector, a private sector, and a social health insurance funds. 9% of the population lost its social health insurance coverage between 1997 and 2002, a third of which converted to private health insurance during that period. The other two-thirds switched from social health insurance to public coverage as a consequence of unemployment or informal occupation. Government expenditure as a proportion of total health expenditure remained at about 22% during this period. In October 2002, the government launched a program that provides free basic medicines to Argentines who use public sector facilities and are unable to afford medicines. Although this program has successfully provided medications to those more vulnerable while strengthening primary health care utilization, there are concerns regarding the long-term viability of the program since it's financed through loans from the Inter-American Development Bank. Private sector healthcare expenditures rose from 44 to 48% during this period, about two-thirds of which were out-of-pocket expenditures. Private health insurance is considered to be an extra in Argentina, above and beyond the publicly available health care. It tends to be rather expensive, and most poor households do not have this additional coverage. To wit, only 3.5% of the households in the lowest economic groups had private health insurance in 1997. Analysis shows that although an increasing number of households purchased private health insurance after the economic crisis, they reduced the level of coverage in the policies they purchased to reduce their total household expenditures. The author's analysis shows that despite making health care more available for the lower economic groups in the country after the economic crisis, outpatient healthcare utilization rates increased for the wealthier citizens and declined for the poorer citizens. In other words, the worse the economy got, the greater the percentage of outpatient healthcare the rich utilized. The poor simply couldn't afford to pay the required out-of-pocket expenses or for private healthcare insurance. As a corollary to this point, the public healthcare providing system became more poor-oriented, while the private healthcare system became significantly more rich-oriented. The net effect was a broadening of the gap between the healthcare options available based on economic status. In conclusions, the authors emphasize the importance of economic stability to the financing of a country's healthcare system. They emphasize that Argentina's healthcare system is resting on shaky ground and still subject to further economic troubles as the country struggles to recover. Even though public expenditures as a function of GDP remained constant, total pesos spent declined, crippling the entire system. Socioeconomic differences in the population also affected the healthcare system, driving the poor to the publicly funded portion and the rich to the privately funded portion of the system. Although the U.S. has not suffered an economic downturn in over 80 years, at least at that level, there are plenty of latter-day prophets who predict one for our near future. During our Depression, we had no publicly funded healthcare system, but we have one now. Based on this analysis, the implications of such an economic disaster for our healthcare system, not to mention the very social fabric of our country, are enormous. If nothing else, this article drives home the need for us to carefully consider how we build our healthcare system, especially as we implement and debate the current changes.